Breathing sustains life. Every time you breathe in precious oxygen, it makes everything work inside your body the right way. That's oxygen. But what happens when you take a puff of a cigarette? Just one puff. As you inhale all that smoke, you're inhaling 7,000 chemicals, 200 plus known carcinogens, hydrogen cyanide, carbon monoxide, ammonia, amongst others. But it doesn't just affect your lungs. Every puff of a cigarette is causing your heart to beat faster, your blood pressure to go up. It affects every single organ system in your body. If you didn't think so, smoking even can cause you to get bladder cancer. Your lungs, after 10 years of smoking 1 pack per day, this is what they might look like. But the good news is it's never too late to get rid of that damage, to turn the corner, and here to help us with an approach to quitting is Dr. Frida Lewis Hall, the Chief Medical Officer of Pfizer, and I'm so glad you're here to talk about this. So very important.
Thank you so much. It is just great to be here. You know, many people believe that smoking is just a bad habit, but it's more than that. For many people, it is a very serious addiction that leads to all of those health consequences that you just talked about. Now, I know firsthand. My mother died of a stroke when I was in medical school, and she was a lifelong smoker. Now, I believe that my mother could do anything, but she could not quit smoking. But here's the good news. You can quit.
It can be done, and sometimes we have to appeal to people's vanities, because another reason to quit smoking is not just about lung cancer and all these other things. It doesn't just affect the insides, it can affect the outside.
That's exactly right, Travis. Cigarettes age your skin faster than anything else other than the sun. So smoking deprives the skin of oxygen and nutrients by affecting your blood vessels. And those chemicals that you alluded to, they trigger the destruction of what we need in our skin to keep it healthy and rosy. Collagen and elastin, the fibers that give your skin that youthful look to it. When a smoker comes into my office and wants to talk about reversing the signs of aging, what do I typically see? That smoker's pucker, those wrinkles around the mouth, and those are some of the toughest things to get rid of. In most cases, facelift, chemical peel, CO2 laser, even all those things will not eliminate all of the lines that I see after smoking.
And speaking of appearance, a lot of people don't want to try to stop smoking because they believe that they'll gain weight. Well, that may be true. Food is going to taste better, it's going to smell better, and you may put on a few pounds. Losing those few pounds will be a lot easier than dealing with some of the chronic illnesses that we talked about earlier.
And you know what? When it comes to appearances, who really cares? If smoking increases your risk of, say, cataracts as you age, which it does, it makes it more difficult to see as the cornea clouds over. It can also weaken your bones, cause osteoporosis. So some studies even suggest people who smoke may be more likely to go bald, develop gum disease. And here's the one key here. If you quit, a lot of the damage can be reversed.
That's exactly right. Here's the beauty of it. When you quit, within minutes, your body starts to heal itself. Within minutes. In the first 20 minutes, your blood pressure and your heart rate come back down. Within the first 12 hours, your carbon monoxide rates come down. Within the first 2 weeks, your circulation and your lung function increase. And within a month, just a month, that cough and your shortness of breath begin to decrease.
You know, and talking about quitting smoking can also help reduce the appearance of yellowish, gray, or pale skin that we talked about, and the yellow nicotine stains on your fingers, your fingernails, and your teeth do begin to fade.
So here's the question. What do you do if you really want to quit? First of all, talk to your doctor. Your doctor can help you by understanding the options with you and putting a plan together. Don't forget to tell your doctor that you've tried to quit in the past and what worked for you and what didn't work for you. That'll help make a better plan. And suggest adding counseling. Counseling will increase your chances of success by a great deal. Remember, most people are not successful the first time. It takes a while. Do not stop trying. If you want more information on the impact of smoking and on additional ideas for quitting, you can go to my website, healthierworld.net.